So with that, I'm going to introduce our first speaker, who is Teresa Donnelly. She's the ADON in National Practice Development Unit and has worked in Sligo University Hospital as a nurse for 25 years. She's a great interest in education, and she's currently completing a PhD. And this presentation is based on her research. I think you're going to talk to us about the stress that nurses have experienced during the COVID pandemic, and I really look forward to hearing your talk. Thank you so much. Let me just wipe down the podium before you come.
I suppose, first of all, before I start, I was one of the recipients of the SEED grant, which I'm very thankful for. And I suppose I couldn't have done my studies without that, or without the support from NMPDU or Sligo University Hospital. And also, during my research journey, I had to go back several times to the ethics committee, and it was very stressful each time, and they expedited every time. So thank you all for that, and I think it's fabulous that we have this service in Sligo. So as you know, my research is on nurses' perception of stress during the COVID-19 pandemic, and it was I suppose part of my PhD studies, and when I started initially, COVID hadn't featured. However, as I went through my studies, I had to rechange and incorporate COVID, which was very relevant at the time. So as we know, stress is highly ranked as, globally as a high risk for people internationally, and nursing is considered one of the most stressful professions. The contributing factors include the emotional nature of patient demands, the long working hours, the interprofessional as well as the interpersonal conflicts that we often face. And in recent years, the advanced use of technology, healthcare has become more complex. We've had budgetary constraints, and all of these have contributed to our personal stress for nurses. And throw into the mix in recent times the pandemic of COVID-19, which has completely changed how we do things. So that has impacted hugely on a nurse's stress. So I suppose, there is emerging evidence, it's coming out internationally about the impact of the pandemic on stress. And one study suggested that 33.4% of healthcare workers suffered from anxiety and stress as a result of the pandemic. And as you can see there's some very interesting work there. I thought it was very interesting that 37.8% of nurses had a dysfunctional level of anxiety. So therefore I felt that it was pertinent and relevant at the time to explore what was happening at this time with nurses. So the aim of my study was to do just that, and I employed a qualitative methodology using semi-structured interviews. I got ethical approval, and as I said, I had to go back several times to start my study, and I invited nurses from across all the directorates in the hospital to take part in the study. So considering the inclusion criteria, 34 from different, very distinctive participant groups were included, and that included medical, surgical, unscheduled care, and oncology. I analysed my data using in vivo, and I used thematic analysis to look for themes and frequencies. So the demographics of my study, or I suppose from that, three main themes were developed. And these were the causes of nurses' stress. So what was causing the stress for nurses? The second was the impact of this stress. And the final theme was stress management strategies that had been employed. And each of these themes then led to the development of sub-themes. So the study participants ranged from 23 years to 59, so it was across the whole profession of nursing. Length of time qualified was 1 year to 40 years. And 53% of the nurses were senior staff nurses, 35% were junior, and 13% were clinical nurse managers. And again, the four main directorates were evenly represented. So the first theme, causes of stress. So again, that led to the development of 3 sub-themes. Adapting to COVID-19 was the first sub-theme, and that was a key cause of stress for all the nurses in this study. So the changing work environment and how we did things was cited as being a main source of stress for everybody. So as we know, to put the changes into context, we all had to act fast. We had to change how we did things. We had COVID and non-COVID areas. We had pathways, red and green zones. People from maybe less critical areas were redeployed to work in more critical areas. So they were working in areas they weren't familiar with, and also with people they may not be familiar with. So this was hugely stressful for the people that were in the study. And I suppose the redeployment was cited as being a key stressor. There was also a real fear around COVID. People had this dreadful fear. So they were afraid of contracting it, and they were more afraid of passing it on to their loved ones and to their patients. And I suppose this was further compounded, to coin the phrase that everybody used, was the anticipatory anxiety. So we were watching countries where their health services were overwhelmed. So people were waiting, and they expressed it as we were waiting for the worst to happen. We didn't know what was coming. However, what people did say, that once they started looking after the first COVID-19 positive patient, all those fears were allayed, or a lot of them were allayed. And the other thing, I suppose, that people felt that, whereby the initial panic and the initial fear was overridden by a sense of duty. I want to help. So I think that's very important as well. I suppose the other thing we looked at then, the second sub-theme was workload. So workload was very stressful. So people felt under pressure to get the work done within their time frame. And they had concerns about the staff-patient ratio. Workload was impacted by skill mix, and the majority of nurses talked about the current staffing shortages and how this had a huge impact on their experiences of stress. And some people actually felt that they were going home with work left undone due to the lack of time and lack of resources. So the final sub-theme was management and organisational issues. So within that, and I think it's very important to just highlight that out of 32 out of the 34 interviews, people felt that communication was ineffective. They felt that it was ineffective between colleagues on the ground, ineffective between management and staff, and in actual fact, there was a lot of people who had concerns that the communication with the patients was ineffective because it was rushed. There just wasn't the time. I suppose very interesting, and I haven't seen any other studies that have highlighted this, the WhatsApp group, which as we all know and we talked about, is the digital messaging tool for collaborative communication. People found that extremely stressful because they felt that when they went off duty, it was constantly pinging. They never felt they were off, and they felt that it was always somebody ringing in that was sick or they were short-staffed, and they felt this guilt, so they felt they weren't getting a break from work. It was continuous. Other management issues that were reported was a lack of involvement in decision-making. People felt they weren't included as much as they should have been. There was poor teamwork cited, lack of leadership, and a lack of inclusivity was cited by some. So it's learning for us, I suppose, as leaders and going forward. For some nurses, they felt unsupported, and there was feelings of inequity and favouritism in some situations. And organisational factors that were reported included high sick leave, and this caused stress for the people that were left on the ground. And others cited that there was a lack of career progression, and they would like to have more opportunities to develop themselves, and they felt that they had poor role clarity and role definition. So that was the findings under the causes of stress, the 3 main sub-themes. So then I looked at then what was the impact of this stress on people. So 3 sub-themes were developed again. So the impact, I looked at the impact on the individual nurses. So the impact included physical, psychological, behavioural and emotional. And the majority of nurses had developed some type of physical symptoms as a result of stress. And that included headaches, unable to sleep, insomnia, apathy. Some nurses talked about they had palpitations, not able to switch off, increased blood pressure. These were the physical. Then other people talked about behavioural. They talked about becoming irritable, narky at work and at home. Developing unhealthy habits such as overeating, drinking, they just felt that this impacted on them physically. For some, I suppose, they talked about stress causing psychological symptoms, and they had low mood and self-doubt. Sick leave was impacted by nurses' stress, and some people actually saw sick leave as an option to help them deal with their stress. So then I looked at the impact on patient care. So all of the people in the study felt that their stress impacted on the care they delivered. And they had concerns that maybe there might be omissions as a result of stress. So finally then, I looked at the impact on the environment, and what people felt was that, and I suppose we can all relate to this, that it was palpable in the environment, that when you walked in, you could sense stress, and it led to low morale. So the final part of my study, I looked at stress management strategies. So again, that's broken into 3 sub-themes: individual stress management strategies. So most people had developed some type of personal stress management strategies, and that was mostly, hobbies, exercise. Social support was important for everybody. That being able to talk to their friends or their colleagues or their families and just sounding off somebody, they felt that was a huge stress buffer. I suppose then people talked about exercise was very important, and hobbies, as I said. Nurses really did recognise the need to make time for themselves and to help manage stress. Rest and sleep was considered so important to help them cope with their stress. So then I looked at the second sub-theme was work stress management strategies. So the hospital and the HSE have laid on formal stress management strategies, and people found them beneficial when they were available. However, the barrier to attending those was that they didn't want to come in on their time off, and work didn't always permit them to do that. But I suppose very interesting was that informal strategies for some was it managed their stress, or they were able to cope better with their stress if they were acknowledged, or that they felt valued. I suppose breaks, the simple thing as a break, was perceived as so important, and people felt that they could manage their stress much better when they had their regular breaks. So I suppose the final part then is I asked people then, how did they feel that we could manage stress going forward? What would they recommend? So they felt that, stress is part of life, and that it's real, but better communication, more collaborative communication, better support, improved teamwork, a greater appreciation. They felt better leadership, increased staff numbers, and we'd all love that, feeling valued, being recognised, feeling respected, the need for more stress management strategies and training on site. And people felt it was important that if they saw senior management on the ground, they felt that that led to them having feelings of more support, and that reduced their stress. So that was the findings overall of my study. In addition to that then, I completed, I suppose, a quantitative part, and I surveyed all of the nurses in the hospital as an add-on to this. And I suppose the concluding remarks is that from the overall study, combining everything, 70% of our nurses are experiencing high or extremely high levels of stress. And I'm sure that's across all disciplines, but this study was just focused on nursing. So there is certainly a need to address it going forward, and thank you very much for giving me the opportunity. I've really enjoyed presenting my work, and it's a very tight snapshot to get it all covered, but thank you.
Thank you. We'll just see if I can get this to work. Can you hear me? Yeah. Teresa, thank you very much for your presentation. Really interesting. I was surprised, I guess, how much physically the stress impacted, and also that little bit about how the stress affects you being able to offer the care, and also the importance of communication. Really interesting. I'm just going to give the opportunity for anybody to ask a question from the floor. Is there anybody who would like to ask a question? You can shout it out. John has a question.
Thank you very much. Very interesting study. I have 2 questions, if I may. One question is on the communication, again, going back to what Anne said. Better communication. Did people ever say how you could have better communication? It's easy to say, we want better communication.
So, John, I think in the interest of time, we might go with one question to start with.
Okay.
Is that
how would you, have they given you any idea how you could have better communication?
So for the audience online, the question is, how did the study reveal any ways that better communication might have been done?
I suppose, yes, what people felt was that, you know, if they were more included in decision making, and sometimes information was mixed initially when COVID hit, and it was delayed in getting to the people that were actually on the ground, that there was poor information sharing. So they, you know, and I suppose what we've looked at maybe is, and it's briefing at the end of the day. A lot of people felt that they weren't included in the communication that was happening behind the scenes. So I suppose that's something we're looking at, and it's something that probably should be incorporated in our daily work and at handover, is briefing, that everybody knows what they're doing and that they've clear role clarity and that they're aware, and if they've any questions then they can ask then. But it was just as simple as being included or being informed, and people felt that, and I know at the time it was changing so fast. We had so many versions coming down on what to do, but sometimes that didn't filter down to the people on the ground.
Very much.
I hope that answers, John.
John? Yeah. I would love to give the opportunity to ask more questions because it's such an interesting topic, and I'm afraid we're short on time.
That's okay, Anne.
And I think this may be a feature of the day, but thank you so much. And I'm sure during the break, if people want to chat to Teresa, they might come and approach you and talk to you about it. Thank you so much.
Thank you so much.